Tēnā katoa, kei ngā pau o te whare, hauora ki Aotearoa, kei te mihi. Tēnā koutou i tā koutou pōwhiri mai i a hau, e mihi ana ki ngā taura tangata i hono ana i a tātou katoa ko te kaupapa o te rā, te rā. Tēnā koutou, tēnā koutou, tēnā tātou katoa. Thank you, David, for that introduction and for the welcome. And it is genuinely an honour and a privilege to be able to open this very important conference on this occasion today. Like you, I also acknowledge your supporters and other hosts, the University of Otago, Aotearoa, Sustainable Health Sector National Network, Global Green and Healthy Hospitals, Pacific Region, as well as the many other organisations. Very interested to see the ASMS there, good friends at the ASMS, as supporters of this conference too. Very pleased, of course, to be in a lecture theatre named after Sir Arnold Nordmeyer, who those of you who are familiar with your New Zealand history will know that he was the Minister of Finance in the late 1950s and was the author of the infamous Black Budget in 1958, which increased excise duties on tobacco and alcohol. So he was way ahead of his time in terms of public health issues, and they were promptly voted out of office 2 years later. But anyway, that was not a reason not to face up to those challenges, I hasten to add, but very good to be here too. Can I also thank you, David, for your ongoing work in this particular kaupapa, and to all of you who are engaged in these very important issues, not just for our health sector, but for Aotearoa New Zealand as a general rule. This is a pretty exciting time for our health system at the moment. I say that as Minister of Health. I know that a lot of people in the system are feeling, actually pretty pressured, not just because of the pandemic, but because of systemic pressures in our health system anyway. But that has led us over, and following some time of reflection and examination, to embark on a period of reforms that I think have the potential to be truly transformational. We will need to be engaged with everybody, with every stakeholder, with every party in order to achieve that. So what we do in the health system, what we do on the sustainability challenge are interwoven and totally interlinked. The vision I have and the vision this government has is to create a smarter, fairer health system. That means looking at every aspect of our system structure, services, workforce and infrastructure and asking, how can we do better? Sustainability has to be at the core of every one of those decisions. Our health service runs 24 hours a day, 7 days a week, and it's no secret that our hospitals use a lot of water and a lot of energy. In fact, health is the largest emitter of carbon emissions in the public sector. So we recognise that the sustainability challenge ahead of us is a big one and requires all of us to be doing our part. It's important to acknowledge the progress already made in reducing the health sector's carbon footprint, and that this work has been underway for more than a decade, driven by clinicians, DHB sustainability managers, researchers, and the wider sustainability community, which is many of you present here at this conference. This important work has established a strong network of expertise and a platform from which to share ideas and accelerate our work to decarbonise the sector and ultimately to improve the health and well-being of the people of Aotearoa. The establishment of the new National Health NZ entity presents a unique opportunity to build on that network, improve the collaboration, consistency and resilience across the health system. The Ministry of Health is determined to seize that opportunity to support this government's carbon neutrality goals. While carbon reduction is clearly a top priority, the health sector's ability to adapt and prepare for the impacts of climate change is also critical. Rising seas, extreme weather changes, and increased frequency of infectious diseases all pose risks to our health infrastructure and the well-being of New Zealanders. Careful long-term planning is vital to ensure the resilience of our health facilities. The system reforms we've got underway will make it easier for us to come together with a cohesive effort to address these challenges and realise the benefits of a more sustainable Aotearoa. Just that person in the audience need a glass of water, or just hope you're okay. Just genuine expression of care, okay? As everyone here today and those of you online are already aware, climate change will disproportionately affect disadvantaged populations that are already experiencing poorer health. Well-planned climate action can lead to substantial benefits to health and well-being and help tackle New Zealand's health inequities. Actions aimed at mitigation and adaptation to climate change will help reduce overall impacts of climate change and improve resiliency among vulnerable populations to achieve equity, health, and well-being. Not only do Māori and Pacific peoples already have to deal with more ill health than other groups, but they are also likely to bear a disproportionate burden of the effects of a changing climate, including infectious diseases, chronic conditions, and impacts on mental health. Part of our strategy for dealing with this inequity is the establishment of a new Māori Health Authority, which I announced as part of our health reforms in April, to provide greater self-determination and address systemic inequities. The Ministry of Health also has Whakamaua, the Māori Health Action Plan, which is designed to ensure Māori receive timely, equitable access, resources, and services. It's early days, but we are looking at how we can deliver health infrastructure projects that improve health equity for Māori. Our sustainability efforts play a key role in achieving better health outcomes and are closely aligned with the Māori worldview, which stresses the importance of looking after the natural environment as well as the physical and spiritual one. Waiora is a significant principle in our infrastructure design approach. It reflects the need for Māori to have access to resources and to live in environments that support and sustain a healthy life. Globally and in Aotearoa, some of the leading health threats include high temperatures and extreme weather events, as well as changing weather patterns and increased risk of infectious diseases, water and food shortages, loss of livelihoods, and forced migration. The carbon neutral government program announced by the Prime Minister in December is a critical policy to help address the causes of climate change. It requires the public sector agencies to measure, publicly report, and reduce their emissions, and by 2025 to offset any that they can't cut. The Ministry of Health is adopting new sustainable design guidelines that will result in low carbon design and construction processes. The design of new hospitals will be guided by the requirements of the carbon neutral government program to ensure that they are fit for the future and resilient to climate change. We'll be applying a green construction standard that considers things like energy, light, and building materials. This is an evolving process, but my expectation is that all new hospital builds will meet these requirements from 2025. Environmentally sustainable infrastructure will reduce operating costs over the life of the buildings and provide better environments for both staff and patients. We're encouraging a range of sustainability tools: low carbon construction design, materials, processes, and waste management and reduction, with a particular focus on target setting and measuring operational and embodied carbon. 7 critical actions are being initiated across healthcare infrastructure projects. Things like rapid reduction of carbon emissions and improved design. One of the critical actions is applying tools according to project size and scale, such as recommending that all new large-scale health infrastructure investments achieve the New Zealand Green Building Council 5-star Green Star accreditation. The Ministry is also developing a prioritisation framework to support a consistent, transparent and fair process for prioritising investment proposals. It's expected that environmentally sustainable construction will be an important part of that framework. I'm encouraged. I want to go through some of the projects that are on the drawing board at the moment. In that respect, I'm quite encouraged by the leadership that some DHBs are showing. Take, for example, the new Dunedin Hospital, known as, would you believe, the new Dunedin Hospital, which is a great example of sustainable design in action. The project will deliver a sustainable, wellness-focused built environment and is targeting 5-star Green Star accreditation, recognised as New Zealand Excellence. This means that design and product specifications for the build require a reduced carbon response, for example, for cement and steel. Low energy intelligent lighting systems will use smart occupancy and daylight sensors to prioritise daylight over artificial lighting. Waste reduction is a key objective, and contractors will be required to comply with waste minimisation plans. The Dunedin Hospital will encourage the use of low emissions transport by staff by providing facilities such as changing rooms, showers, lockers, and secure bike parking. Fleet car parking will include electric vehicle charging points. In addition to environmentally friendly features, the new hospital's design and use of latest technology will mean greater efficiency, including better patient flow around the hospital and better access to diagnostics and treatment spaces, reducing unnecessary delays. The hospital is being built in 2 stages. The outpatient building is due to open in 2025 and the inpatient building in 2028. Further up the country, from my old hometown, climate change, adaptation and resilience have been key components in the design of the Tarenaki Base Hospital's new East Wing building. The 20,000 square metre, 6-storey building will house many of the hospital's acute clinical services, including the emergency department, intensive care, maternity, neonatal, radiology, laboratory, and a rooftop helipad. The seismic risk management plan will also see the construction of a new renal building, energy centre, computer room, and an upgrade of critical infrastructure across the site. The Tarenaki DHB is working with the Ministry of Health and its community to implement this project with a strong sustainability framework to achieve its goals to be zero carbon by 2050 and zero waste by 2040. Energy efficiency measures, sustainable procurement of construction materials, and Green Star performance ratings are built into the design and planning. The renal unit building will target net zero energy certification by reducing energy consumption and using rooftop solar panels to meet its energy needs. Construction of a new energy centre for all critical electrical infrastructure, providing 72 hours of backup power, is also underway at the hospital and is due to be finished next year. This and other infrastructure upgrades will improve the resilience of the hospital campus with the addition of a second emergency power generator, increased water storage, and replacement of the oxygen storage facility. I found this interesting. Given the proximity to Mount Tarenaki and the Central Plateau, the roof is designed to withstand ashfall from a 1 in 2,500 year volcanic event. Not sure the building will last 2,500 years, but presumably a Labor government in 2,300 years' time will no doubt invest in the next building, which will be possibly even more resilient. And finally, there's more positive action in the north too, with the Northland DHB introducing 150 electric vehicles and installing charging infrastructure over the coming year. Northland DHB wants to improve its sustainability while also meeting the needs of staff to travel to patients and around the region. This was made possible through the $4.3 million grant accessed through the State Sector Decarbonisation Fund, which is managed by ECA, the Energy Efficiency and Conservation Authority. The purpose of that fund is to accelerate public sector investments in low emissions technology and fleet conversions. Emissions from coal boilers are one of the top sources of emissions from our health service. I have to say, when I became health minister, I was stunned to see the number of hospitals that are still reliant on coal boilers for heating and other services. There are 26 coal boilers left in our hospitals, and some of these are already being replaced with biomass. But it is our intention as quickly as possible to get rid of all coal boilers. Biomass boilers dispose of waste wood and emit about 60 times fewer emissions than coal-fired boilers. New biomass boilers at the Canterbury DHB's new energy centre will deliver steam to the entire Christchurch Hospital. I can't speak about all of them today, but these are just some of the examples across the country of DHB's planning to ensure greater resilience and adaptability to the impacts of climate change and to improving the health of their communities. I might add, one of the things that we have now got recently is a 10-year asset management plan across all hospital campuses. So we know the hospital builds and infrastructure upgrades that are required over at least the next decade. And you can be sure that as we plan that construction and those projects, that now building sustainability into all of them is just now part of standard thinking for that work. As I said earlier, our health reforms will see DHBs replaced with a new agency, Health New Zealand, from July next year. I'm confident that having the health system under a single organisation will improve our ability to plan for and deal with climate change, whether it's cutting emissions or dealing with the impacts, including health, that we cannot now avoid. For now, though, the Ministry of Health's Infrastructure Unit is working with DHB sustainably, the DHB sustainability and facility managers to ensure the health sector is ready to meet the requirements of the carbon neutral government program. The National Adaptation Plan is being developed by the Ministry for the Environment, and work is also underway on a more specific health national adaptation plan to support the planning already being done by DHBs. Part of the reason for the reforms too, apart from trying to rationalise decision-making to fewer than 20 points, which is it is at the moment, is actually about addressing our healthcare models. And it's in this respect that I think we also have an ability to make some gains when it comes to the sustainability challenge. I'm looking at how we can change healthcare models to deliver more services in community care facilities. This will make it easier for patients to access healthcare in smaller and more energy efficient buildings. And having more local health services also improves transport energy efficiency. Beyond just energy efficiency and transport efficiency and that part of the sustainability challenge, there's also simply the question about how do we meet the rising demand for healthcare and all its dimensions and all its levels in the system we've got at the moment. That's a sustainability challenge too, and that's another driver for the transformation upon which we are now embarked. Climate change is not only the nuclear-free moment of the current generation, as our Prime Minister has said, but it also poses a significant threat to human health, well-being and health equity, both globally and in Aotearoa, New Zealand. It's also an opportunity, though, to take positive, well-planned and decisive action to improve the long-term health and equity of the people of Aotearoa, New Zealand. I don't underestimate the scale of the challenge, but the ambition is there, we're committed, and I believe that together we can achieve our vision. Thank you for giving me the opportunity to speak today. Nō reira, tēnā koutou, tēnā koutou, tēnā tātou.
Minister. I know that the Minister is on a tight schedule, but he's available for questions, and it would be great if the audience if you have questions, to introduce yourselves and ask them. Thank you.
So the question is, are there plans to integrate sustainability planning and work into the new Health NZ? That comes from somebody from the Northland DHB. Yes, and my expectation is that functions that are operating right now, whether at the ministry or at the DHB level, will be either kind of aggregated, consolidated, but that must continue. I think the benefit of Health NZ is we can take things like the Health Infrastructure Unit, plus the skills and talents we know that reside more regionally in the DHBs, to create, I think, a very powerful unit addressing not only the infrastructure needs, but actually also the climate change and sustainability imperatives that go with future asset planning. Are you worried about your jobs? No. No, that work is fundamental. So I'm not trying to be flippant about that. That goes with any large public service function. Now, as we think about the future, bringing that intellectual grunt to how we think about both the services and the places from which they operate and how they're delivered, that is the way of the future. So that work will continue. Question in the back.
Sorry.
Hello, Simon. Oh, apparently there's a microphone because we need the folks in Etherland there to hear it as well.
Sorry. Good morning. Thank you for your address. My name is Simon Watts from the Brighton Observatory of Environment and Economics. I'm really interested in the Ministry of Health adaptation plan. Is it coordinated and part of the Ministry for the Environment adaptation plan, or is it separate? Over.
No, they are. The Ministry of Health plan is aligned with, in fact, they're working to the Ministry for the Environment work on this. I think that's all government departments who are putting together their climate change responses are doing so in alignment with the Ministry for the Environment. So no one is, there's no isolation on this. No one is sitting in their own island. This, in terms of across government, has to be coordinated and coherent. That's what we're trying to achieve. Yes, Daniel.
Kia ora, my name's Sally Fazandia. I'm an interested member of the public.
Oh, I like those.
I am really struck by the number of weather events that we're now having in New Zealand, and thinking that the government is having to put up millions, perhaps billions of dollars in the next couple of decades dealing with the ambulance, being the ambulance at the bottom of the hill, in terms of, you know, like a primary care model. Do you think you're actually putting enough resources into going hard enough and fast enough to mitigate rather than adapt and respond?
Yeah, that's a really good question, and that I can tell you that occupies cabinet thinking and discussions a lot, because we know that a lot of, and this is kind of also working with local government, who are really the owners and stewards of much of the infrastructure that we're talking about. And I think we are acutely aware that at some point we are going to have some very honest, but what would be seen as, for the time, very brave conversations in terms of our adaptation response. There are some places, some communities, some townships that are in places where they will not survive there. And we're going to have to work out what that means, what it means to move populations around. We know that, look, for example, in our kind of 3 Waters program, huge infrastructure investment required to bring our underground infrastructure up to spec, so that it is way less vulnerable to the weather events that you're talking about, and so that we can have infrastructure that better responds to the impact of those weather events. That is huge investment. Local government cannot do it alone. Not sure necessarily central government can, at least in a short space of time. So I think part of our thinking challenge is the horizon we give ourselves to make the investments we needed to make, and to make the adaptations that we needed to make, and to do that planning about where is it sensible for people to be located if we're going to protect them from some of the worst ravages of weather events that, as you say, are now more common, and we all expect will intensify over the decades to come.
Kia ora, Minister. We've got a question from Slido, which is where we are asking questions through this conference, so feel free to jump online there. So we've got lots of talk about buildings, little reference to process. What about reducing the use of single-use surgical items, for example?
Yes, good question. And no, I haven't addressed that. And I would probably have to defer to our DHB experts, who will be kind of closer to that frontline kind of more granular opportunities for kind of better resource use. So let me just acknowledge the point, and accept that as a matter of principle, I'm sure we can do better, but I will defer to those with greater, more detailed knowledge than I can bring to that question at this point.
Only one? Have you got another one there?
I've got heaps.
Or do you want to do a second one?
There's quite a few curly ones, but sorry, they all seem to be quite curly.
That's right.
So is there any intention to deal with the inevitable growing mental health impacts of climate change in the coming decades due to climate-related crisis?
Yes, and that's very much the focus from the 2019 budget investment, where Aotearoa, in fact, their first recommendation was about what we have available for those with mild to moderate mental health conditions. So those with sort of anxiety, those with mild depressions, and getting much quicker and more ready access to the talk therapies that are beneficial for that end of the mental health sort of spectrum. So that's why we're stepping up and we've got a 4 to 5 year program to roll out the health improvement practitioner and health coach sort of aspect of it. We're kind of partway through that. We have about 360 people now in those roles. We are still less than halfway through the full rollout. So my expectation is that that will make a difference. It's making a difference now for those who have access to it. It will continue to make a difference. We know we still have work to do in the acute end of the mental health spectrum as well. Some of that is about having facilities that are more fit for purpose than they are at the moment. But actually the long-term aim is to prevent people having to require access to the acute end of care and deal with the drivers of mental health, of mild to moderate mental health issues at a much earlier stage through better access. That's what we're trying to get to.
Older. And one last question. Are there plans for Health NZ to have a dedicated sustainability unit?
I mean, we're in the early stages of planning what that looks like. But you can be sure that whichever part of Health NZ is responsible for, whether it's the infrastructure, whether it's the supplies, meeting the sustainability challenge will be infused through Health NZ's decision making throughout. It's not seen as a kind of a separate nice to have. It'll be fully integrated into the way that organisation operates.
Question up the back.
Kia ora, Minister. Paul Wilson from Bay of Plenty DHB. I just want to address the anthropoid in the corner, the human aspect of healthcare. Tangata, he tangata, he tangata. As the uncontrolled experiment in Waikato has proven to us over the last month, digital devices have made us probably twice as efficient, but human beings are still at the core and always will be at the core of our healthcare system. What are you as Minister going to do to make sure we retain our people in this country? At last count, for every 3 medical specialists, and I'm sure this is right across our entire workforce, for every 3 medical specialists we train in New Zealand, 2 of them work in New Zealand and 1 works in Australia. That's probably around about a thick end of $1 million of foreign aid to our lovely neighbours who we cherish, but they don't need that money. So what are you going to do to keep medical practitioners, nursing staff and other valued members of our community here in New Zealand? As the last year and 18 months has shown us, it's gone from PPE nationalism to vaccine nationalism, and if around the corner there could well be healthcare worker nationalism. How are you going to counter that?
Yeah, thanks, Peter. Yeah, and these are big challenges, and some of them are done through the remuneration processes that we have underway at the moment. We have the nurses, they're engaged in 2 processes. One is their standard collective bargaining, the other is the pay equity, which ought to achieve the significant catch-up that has been long awaited. So that process is continuing. That ought to do a lot in terms of both recruitment and retention into that part of the healthcare workforce. But that alone isn't enough. We know that. It is about working conditions. I mean, when it comes to nurses as well, the other big program of work that was signed up to in 2018, which from what I see, the reports I see, we're nowhere near kind of completion. It was due to be completed by the end of this month. That's the Care Critical Demand Management System, which has required additional nursing roles. The government has funded additional nursing roles, but many are vacant because we are not producing the workforce out of our training institutions to fill them. So we are still trying to get that, conclude that piece of work. In terms of the investment in future workforce training, get that right as well. Then when it comes to your medical specialists, your senior medical personnel and what have you, again, we have the training challenge that we've got, partly an immigration challenge. We have always relied on overseas qualified medical graduates to work in New Zealand to fulfill the various roles that we need here, and we will continue that. We need to have an immigration settlement. My expectation, I've made this very clear from the outset with Health NZ, is that they will have a dedicated team, but a very clear mandate in terms of long-term workforce planning. We need to be thinking about that pipeline 10 to 20 years out, not in the kind of haphazard way that we do at the moment. So that will mean Health NZ as an organisation will have kind of the scale and the means and frankly the grunt to engage with training institutions and others and work on pulling together how we build our talent for the future. So it'll be a combination of remuneration, working conditions, and that goes with built environment as well, and our workforce planning function, and getting all those things doing their job properly and aligned, I think, is our best hope for the future.
Thank you. Minister, one last question. Okay, up the back there.
Hi, I'm Ruth, a doctor from Hawke's Bay, DHB. In terms of the growing private healthcare sector, what are the expectations upon them and what's the engagement like with sustainability as they continue to build new hospitals and grow?
We don't, I mean, at my level, I don't, apart from kind of hearing what they're doing, I don't have a great deal of engagement with them. I mean, the reality is our private hospitals are part of our health system. There's always been a big private element to our total health system, GPs and others, pharmacists running private businesses, but with a huge amount of public funding sort of going into that. We know that the private hospitals often pick up overflow work from the public system. Public system engages the private hospital network to pick up that sort of work. So my expectation is that that will continue, but my job is to make sure while I'm in this role is I'm doing everything to make sure that we have the best possible public health system that is as responsive and available to all New Zealanders, regardless of who they are and where they are. That's the system that we need. What the private system does to complement that is kind of up to them to gauge where the gaps are in the public system. I just want to minimise those gaps.
Kia ora, Minister. Thank you very much for coming today, making yourself available, answering questions. It's always tricky, you never quite know what you're going to get. That's the job. It's a tough job. It's probably the toughest job in Cabinet, I think, but we're very grateful to you. And I hope that we will be able to help you through our networks with the work in this area. We've got some great people here. We've got an enormous amount of knowledge in the room and around the country, and we look forward to contributing to helping the government reach its goal for the public sector to become carbon neutral by 2025. Thank you, sir. Thank you.